Good evening. Hi, I'm Marla Barthen. I am our co-president-elect of the Lower Cape Fear League of Women Voters, and I welcome all of you tonight to Periods Don't Stop for Pandemics, the menstrual equity in North Carolina. So we have a great panelist for you tonight, and we have lots of special guests. So let's get started. I just wanted to let you know that the League of Women Voters of the Lower Cape Fear is a nonpartisan organization, neither supporting nor opposing candidates or political parties. The League of Women Voters of the Lower Cape Fear is an organization fully committed to diversity, equity, and inclusion in principle and in practice. To learn more about our policies and organization, please visit our website at www.lwvlcf.org. The League also recognizes the tribal lands of the Waccamaw, Siouan, and Indigenous peoples of the Lower Cape Fear. So tonight's panelists, we have Michaela Howells. She is a PhD assistant professor of biological anthropology at UNCW. We have LaShonda Wallace. She's a nurse practitioner and also, I believe, the director over at Seeds of Healing. I'm going to say that wrong. And State Representative Julie Van Haven of Wake County, or I think her district's up in Wake. So I'm going to we have so many more distinguished guests that came in kind of at this last bit. Everybody's jumping in. So I'm going to let Michaela go through and continue on introducing everyone. So let me tell you a little bit about Michaela. She is a biological anthropologist and human biologist specializing in maternal and child health. In addition to her research in the South Pacific, Africa, and Asia, Dr. Howells has conducted research on the impact of disasters like Hurricane Florence on pregnant women in New Hanover County. She is the director of the UNCW GAPS program, Growth, Adaptation, Pregnancy, Stress Lab, and a board member for the UNCW Gender Studies program, and a member of the UNCW Racial Justice Learning Community and the New Hanover NAACP. She is the director of the Periods Don't Stop for Pandemics program that seeks to increase menstrual equity in New Hanover County and in North Carolina. The three immediate foci of this program are: one, a large-scale donation collection for menstrual hygiene products; two, a push to repeal the pink tax, an additional tax added to menstrual products because they are deemed a luxury item; and three, to increase education around period poverty and menstrual equity. So welcome, Michaela, and all of our guests.
You would think after being on Zoom all day, every day, I'd learn how to unmute myself. But thank you, Marla, and thank you to the League of Women Voters for offering to host us today. And I'd like to shout out to our team for the Periods Don't Stop for Pandemics. Mary Claire is with us. We've got Megan Funderburk is in there. We've got Leslie Cohen. We have other team members, and I'm sorry because I only see 3 people right now because I'm sharing my screen, but trust me, there's a lot of excellent people on this team. LaShonda Wallace is part of this as well, and it takes taken a large group to bring this all together. So with today's discussion and presentation, let me see if I can convince my PowerPoint to move forward. Give me 1 second here. Trying to convince my PowerPoint that it wants to work. Okay, so let's try that again. Okay, can you all see my PowerPoint? All right. So what we're going to talk about today is we're going to go talk about period poverty. What is period poverty? We're going to talk through health impacts associated with period poverty and menstrual equity. And we're going to talk about the short-term relief that's going to be the donation drive that we'll share through the towards the end of this section, and the long-term change. And the long-term change is really going to be tied up in policy change. So we are so lucky to have 2 bills that have been brought up by some of our really strong leaders within the House and the Senate. Within the Senate, we're thankful to Senator Mayfield, Senator Murdock, and Senator Marcus, who have brought SB 614, which is Feminine Hygiene Product Sales Tax Exemption. And then in the House, we have House Representative Von Hafen and also Representative Deb Butler, who brought forth H595, which is the Hygiene Product Sales Tax Exemption. Now, we're lucky to have some of these senators with us tonight to talk about, introduce themselves and to share a little bit about their bill. Now, they do have a tight timeline, so we put them at the beginning so they can touch bases, say hello, and move on. So first, I'd like to ask to hear from Senator Murdock. If someone could, if we could have Senator Murdock be pinned there, that'd be great. Senator Murdock is an entrepreneur and servant leader representing Senate District 20, which is in Durham. Before her election to the Senate in 2020, she served as Durham County's Soil and Water Conservation District Supervisor and Deputy Director of Communications for the North Carolina Department of Justice. So Senator Murdock, we'd love to hear from you.
Great. Thank you so much, Michaela, and so happy to be here with all of you this evening and actually have a brand new connection to UNC Wilmington. I am back in school, so I'm getting my MBA from UNC Wilmington. So when I saw the UNC Wilmington campus paper pick up this bill, was really excited about that. And so like a number of new legislators, I'm a freshman, I was appointed last April, and this was an issue that has been on my heart for some time. I think my entry point to period poverty as a topic was actually through a training. One of my sorority sisters, I'm a proud member of Delta Sigma Theta Sorority Incorporated, and she's been doing a lot of work in the Atlanta metro region. One of her undergrad degrees is from North Carolina A&T, and she founded a nonprofit called POSH-PAC. And that was actually the first time that I was aware of period poverty and kind of what that means. And so was thrilled to learn that Senator Marcus was going to file this bill for a sales tax exemption. And so was interested in that topic to just repeal that sales tax. Those that have menstrual cycles are actually paying $8 million in taxes that other folks are not paying if they do not have to purchase these items. There's been tons of research to say that, you know, this is a medical need. This is something that we need. It's not a luxury item. So was thrilled to join her with this bill. And Senator Mayfield joined me in filing the End Menstrual Poverty Act. And so that act also deals with the impact of the school. So that POSH-PAC nonprofit that I brought up earlier, they are based in Georgia and would love to continue the conversation. Georgia has a coalition that does work around this. It's statewide, and they're very active in the Georgia General Assembly. And they were actually able to get a 6-figure appropriation in their budget so that school districts could purchase these items and give them to students. So that is what is listed in the End Menstrual Poverty Bill. The National Education Association says about 1 in 5 young girls does not have the financial means to purchase these products. So wanted to deal with the lack of those in the schools. And that bill also includes some language around working with our diaper banks. Another nonprofit I've learned about in Texas, they provide these items for free in your homeless shelters, your domestic violence shelters. So areas where women are truly in need and at risk, there's always a need for that. So definitely want to continue to work with you all as we seek to tackle this issue. And I see some activity in the chat. Other states have done it. Other states have repealed the sales tax. Unfortunately, our tax code is a little rigid. I thought maybe we could just reduce the tax to 2%. Not going to work. We have a certain streamlined system for our taxes. So we would just have to do a full-on repeal, and also following other states that have these items for free in bathrooms in their public schools. So thank you all so much for shedding light on this issue. Period poverty is real. And I'll close with sharing a personal story. I really love love mentoring young girls and women. And a young girl that I was mentoring let me know that she didn't have the funds to buy these items, and she was actually using her grandmother's diapers. So that was when I said, we've got to tackle this, and am thrilled to say the Department of Public Instruction is actually supportive. It's still going to be an uphill battle, but 6 figures is not a lot. In Georgia, I think the budget appropriation was around $400,000. So I definitely think we need to continue to work and figure out a way to get these products in our school systems free of charge at some point in an upcoming session. But thank you all again for having us tonight.
Thank you so much, Senator Murdock. We're really pleased that you could make it today, and thank you for the work, and look forward to chatting more. And go Seahawks. Senator Marcus, we would love to hear from you if you wouldn't mind. Natasha Marcus is serving her second term. I just worried I was muted for a minute there, is serving her second term in the North Carolina Senate. She represents the newly drawn Senate District 41, which encompasses Davidson, Cornelius, Huntersville, Mount Island Lake, North and Northwest Charlotte. She's a community leader and a volunteer and animal lover, a mom, a nature enthusiast, and a former litigation attorney. So Senator Marcus, thank you for joining us.
Hi everyone. I know if y'all are in Wilmington, those town names don't mean much to you, but I am proud that I have Davidson College in my district. So that's maybe one you've heard of. So I'm Natasha Marcus. Mecklenburg County is my county. I'm the mother, as you said, of 2 daughters. So this issue is very relevant in our life. And I'm so grateful that my fellow senators, I realize we're all senators with last names starting with M, so we're the 3M here tonight supporting this bill. And again, just to clarify, this bill, Senate Bill 614, would exempt feminine hygiene products of all kinds from our sales tax, because as anyone who menstruates knows, these are not luxury items, these are necessities. And I believe it's unfair to tax them because only a certain segment of our population has to purchase these items. It's not the same as other things that are essential. There were some men who were attacking me on Twitter for suggesting that feminine hygiene products should be exempt because they said, well, there's other things that are necessities like toilet paper. And I agree, toilet paper is also essential, but the difference, of course, which these men didn't seem to grasp, is that only women and only women of a certain age need to buy these products. And so I feel it's an unfair tax. Most states are moving in the direction that I hope North Carolina can move in by recognizing this fact. And I would say our bills generally, as we're the minority party, don't have a lot of hope of passing. But I know that this one, when I drafted it, I thought, well, you know, Republicans say that they are in favor of tax cuts. And so I hope that they mean it and that they will support this bill, which would give North Carolina women a break. I think it's the right thing to do, and we're going to see what happens. I don't think shouldn't be a partisan issue, regardless of party. This is an issue that all women can relate to. And I will just say that it may be one reason why our state hasn't done this yet, may connect in some way to the fact that we've had very few women in the General Assembly and still have far too few women in the General Assembly, in my opinion. So I'm glad that we've got some new women here with us who we can all join voices on this important issue. And I think it's wonderful what you all are doing to bring these issues to the forefront. This is the first time I've been asked to speak about this bill, so I love that it's getting some attention, and hopefully that will help put a spotlight on how this is a common sense tax reduction that North Carolina should pass. So thank you all for your interest and for the opportunity to speak with you tonight.
Thank you both. Is Julia Mayfield, I didn't see her.
She was still traveling and had a little trouble logging in, so I told her, don't worry about it. If she happened to have joined while I've been speaking, please give her a chance. But I think given the challenges, we should probably just move on to the next speaker.
I'm so thankful to both of you to coming in and sharing your insights. And please, everyone, if you could follow these leaders and social media so they can give you some direction in terms of when they need support in terms of contacting heads of committees and so on and so forth, trying to get the bill moved through. So thank you so much for your time. I know that you have to be in a meeting in just a couple minutes here, so we appreciate your time.
So much. Thanks for having us.
So let's talk a little bit about why all of this matters. Why are we here today? Excuse me, my screen share is really not loving me today. Give me one moment. Okay. Excuse me, it's freezing up here. One moment. So I will say, as I'm trying to get this to work and to share, that, oh, there we go, great. I'm going to ask you all to grab a piece of paper and a pencil or a pen, because I have some little guessing game going on for you to try and fill in some of the blanks here as we work through some of the realities of individuals' lives within North Carolina. So before we get started here, I want to touch bases. Why do we talk about menstrual hygiene instead of feminine hygiene, right? So throughout our presentations, you're going to hear us use menstrual hygiene in place of feminine hygiene. And this is because the reality is it's not just women and girls who menstruate, right? We know that trans men, non-binary people also menstruate, and they have additional challenges in terms of getting their needs taken care of healthy or safely and healthily. So we'll be touching on that a little bit later on. Okay, so what is period poverty? Period poverty is the lack of access to sanitary products, menstrual hygiene education, toilets, hand washing facilities, and or waste management. So shortage of menstrual hygiene resources interrupts school and work. Senator Murdock referred to this earlier. And this is a loss, not just for the individuals who clearly have their schooling disrupted and have their work and their income disrupted, but it's also an issue for businesses. So as we're looking at this is not just the individual loss, but we're also talking about an economic loss by not having workers being able to come in because they don't have their needs met. We're going to talk about the health implications of this shortly, but when you start thinking about what some of those health implications can be. And this is a local and a global issue. Absolutely, all of our counties in North Carolina have individuals whose needs are not met in terms of menstrual hygiene, but we can also expand out. So all of North Carolina, all of the United States, and then going on to the global component. But here we're going to be talking about North Carolina specifically. Okay, here we are in terms of time to fill in some gaps. All right, so we're talking about those who live below the poverty line. What percentage of women and girls aged 12 to 14 do you think live below the federal poverty line? Go ahead and write down your answer. Take a guess. Okay, so 20% of women and girls live below the federal poverty line, right? What do you think about in terms of the number of trans and non-binary people who live below the federal poverty line? Okay, that's 25%, a fourth of all trans and non-binary people are faced with issues surrounding poverty. Again, we're thinking about poverty because we're thinking about access to these pricey products. Okay, so this next one, how many, in terms of percentage-wise, female students, 7th to 12th grade in North Carolina, do you think attend Title I eligible schools, are considered low income, and have challenges affording basic menstrual hygiene? Go ahead and make your guess. 63%. The majority of female students are in this position. I'm reporting here on female students specifically because I didn't have the numbers available to me for trans and non-binary students specifically. Okay, so in the US, when there's a survey done of 13 to 19-year-old girls, and I'm going to throw some numbers at you, but really what I want you to take away is the overarching storyline about what these individuals lives look like as they're trying to manage their menstrual hygiene with dignity. We know that there's, in these interviews, a lot of cultural stigma was discussed and examined. It talked about 25% said they'd rather miss class than go to school without menstrual products. 20% said they couldn't afford to purchase these products. 75% were stressed because they don't have access to these products in one way or another. And 61% wore tampons for more than 4 hours. So Dr. Wallace is going to talk more about why that's problematic. But here we have individuals who have challenges having their basic hygiene needs met, right, in terms of menstrual hygiene. And then they're also adding on to that into a precarious health situation and a potential risk situation. So this part, especially as an educator and someone who's really interested in terms of health, always gets me. A survey of 13 to 19-year-olds, the same one, 76% felt like they knew more about the biology of frogs than they did the female body. Right. So this is also coming back to education and the role of education. As we talk about the long-term goals and needs, right, we're talking about also improving education surrounding these topics, and not just with menstruators, but those who don't menstruate. Okay, we're back to our guessing game. One in how many menstruating people report missing work, school, or other responsibilities because they lack necessary period supplies? So this was mentioned earlier. Okay, 1 in 5. 1 in 5 menstruating people, right? I'm typically not someone who likes to just like have a waterfall of numbers and percentages, but I think these are so overwhelming and telling about the lived experiences of people within our own communities and our own needs. And like I said before, this impacts individuals and it impacts business owners. We can look at also the long-term consequences of this. We can look at the long-term consequences for those who are unable to complete their education, because they're missing school. They're more likely to enter child marriages, which we know is an issue in North Carolina, as well as the United States and also the globe. They're more likely to experience earlier pregnancies, which are also tied to pregnancy complications. They're more likely to be malnourished, and they're also more likely to be victims of domestic violence as they move through their lives. So we're talking about long-term implications for menstruating people to be missing school and engaging in these health behaviors. So I would like to invite Dr. Wallace to speak with us. Let me just tell you a little bit about Dr. Wallace. If you haven't met her yet, you are in for a treat. Dr. Wallace is a family nurse practitioner and the founder and executive director of Seeds of Healing. The goals of Seeds of Healing are to eliminate disparities in HIV outcomes for women, improve the quality of the care received, reduce the number of new HIV infections, and minimize stigma associated with HIV. They achieve their mission with community collaboration for HIV awareness activities that promote HIV prevention and work directly with clients to provide health coaching. As a medical professional and a patient advocate, Dr. Wallace strives to break cultural, religious, and moral barriers that affect people's access to care. We are thankful she can join us today and share her work. So thank you, Dr. Wallace.
Thank you, Michaela. Are you going to advance the slides?
I am.
All right, thank you. I appreciate you so much. So let's talk about menstrual health. And just starting off, let's talk about some of the challenging circumstances that persons who menstruate actually experience. There are many reasons why menstruating people can be marginalized or part of vulnerable situations. So when we think about what is a vulnerable situation or marginalized populations, well, we're talking about persons who are gender nonconforming, and those who may not have access to supplies because they live in poverty. And this could be a student, such as a college student, those, of course, who are in low income communities, or homeless women and girls. Challenging circumstances that are associated with having access to menstrual products is being unsheltered, undersheltered. So in other words, being housing insecure, having inadequate access to clean water and sanitation. And without access to clean sanitation and water, it actually poses a risk for infection. Those infections could be bacterial vaginosis. It could be a fungal infection. And think about the humidity that can actually occur in the pelvic region during a monthly cycle and using products, or when you don't have products, other supplies such as paper towels or socks, even in some instances. Having lack of privacy. Lack of privacy for those who live in crowded circumstances. It may be persons who are incarcerated, or if you live in a home where there are multiple family members and you do not have privacy conditions where that you can actually take care of your menstrual circumstances. But keep in mind, if you are a person who is a transgender male, for instance, the use of a male's restroom where there is no supplies or no access for supplies, not even a garbage pail, so that you can sometimes have access for proper disposal of menstrual products, can also be a challenging circumstance. Low finances. I think that we've sort of covered that in our conversation, but just to talk about, currently 4.75% of tax is assessed to our menstrual products, and this is not really deemed necessary. So again, menstrual products should not be a luxury product because of our biological makeup, in which I already mentioned lack of disposal, especially if you are a trans man. Other challenging circumstances can lead to reduced access to menstrual products, poor menstrual hygiene, and significant health issues. Poor menstrual hygiene, having recurrent vaginal concerns can lead to chronic urinary tract infections, and even at times can impact the reproductive system. So think about, if someone do not have access to replenish their supply, it puts someone who menstruates at risk of toxic shock syndrome, which is also, it can be a life-threatening circumstances, in which two infections that I already mentioned, bacterial infections and yeast infection. Psychological health impacts are astounding. Due to stigma, there's also stigma just for, again, being a person who menstruates. Imagine being in school, if you are in grade school. I don't know if you guys have ever had this situation, but I was a school nurse for 10 years. And sometimes persons who menstruate, they don't want to ask to go to the bathroom, right? We are encouraged to change our menstrual products about every 3 to 4 hours. And if you don't have supplies, that's an issue. And if you're stigmatized because you menstruate, sometimes you don't change, but then it leaves you at risk of having a mistake. So just because you menstruate, that right there is stigmatized. The negative mental effects of feeling embarrassed. It disempowers menstruating people. And again, it causes embarrassment about our normal biological process. Those who are impoverished are disproportionately impacted. And when I say this, I want to particularly highlight the impact that Black and African American women have. Black and African American women are disproportionately affected by prolonged exposure to stress, chronic stress, and stress levels can affect menarche, and increased hormone levels during stress can prolong your menses. African American women are more likely to have uterine fibroids, which prolongs the menstrual cycle, cause abnormal uterine bleeding, missed days from work, financial burden, as well as debility. Young African American girls are more likely to have a higher BMI associated with inadequate nutrition, making menarche come at an earlier age, and Black and African American women and girls have prolonged periods of poverty compared to counterparts and bear an impact from period poverty. Now, anyone can experience these circumstances, which I mentioned, but I do want to highlight that persons of color tend to be disproportionately impacted. So menstrual equity, having access to menstrual supplies can improve a person's health just by promoting routine health promotion, having access to sanitation, which is a way to avoid disease and infection, and it reduces health disparities. You do not have to have unnecessary and unwarranted visits to medical facilities or having access to providers. When we think about populations who experience poor health encounters with the healthcare system, such as non-conforming gender minorities, as well as Black and Indigenous people of color, who usually have reports or often have reports of poor experiences and do not have access to adequate health care or quality health care. And then lastly, having overall access to menstrual equity will improve your life prospect all in all. Next slide.
Give me 1 second here. Oh, there we go. Thank you.
Yeah, so achieving menstrual equity again is having access to sanitary products, adequate access to clean water and sanitation, waste management, as well as having being informed. So not only should we inform persons who menstruate, but what about non-menstruating people? This is how we can eliminate stigma, by just being informed about the natural process, and so that we do not make persons who menstruate feel abnormal for their normal biological processes. Providing privacy for in those instances where there is lack of privacy, as which I mentioned, in crowded conditions. And this is how we can destigmatize menstrual. And of course, as we started out in the beginning of this program, policy change around cost and accessibility. So now, how can we make a difference in North Carolina?
Thank you so much, Dr. Wallace. I appreciate your time. I'm delighted to introduce Julie Von Hafen to speak with us next. But before I do that, I just want to give a shout out. I recognize that Sister Rose is in the audience, Leslie Cohen, and also Shannon Scheibel, who are also critical team members for the Pandemics Don't Stop, Periods Don't Stop for Pandemics. So I'm happy to introduce Julie Von Hafen. Representative Von Hafen was elected to the North Carolina General Assembly in 2018. She represents the 36th district in Wake, which is in Wake County. She has a law degree from Case Western University. She is a mom, a PTA leader, a Meals on Wheels volunteer, and just all around incredible person. She's with us tonight to share the bill that she's introducing to remove the sales tax from menstrual products. So, Representative Von Hafen, are you on?
I am. Can you hear me? I am going to share my screen if I can figure this out. Can you see it? Okay. Well, hello, everyone. So nice of you guys to invite me on tonight. And I'm excited to talk about the bill that actually filed today in the North Carolina House Bill 595, which is an act to exempt hygiene products from North Carolina sales tax. And you heard the senators earlier today talk about their bill, which is Senate Bill 614. They're pretty similar bills, almost exactly the same language. And we were going to file them together, but I've actually been working on getting bipartisan support for the bill for about the past 3 months, trying to talk to many people on both sides of the aisle about the bill. Unfortunately, I wasn't able to get that support, so I decided to go ahead and file the bill this week so that I have an opportunity to talk to you all about it and that you can start advocating for both bills with your members of the General Assembly. So as you know, and as you've heard, periods, of course, have a huge impact on menstruating people in North Carolina. At least here in North Carolina, 1 in 5 women and girls live below the poverty line. And so this is just an issue that's really important to me. And I'll tell you a little bit about why I got interested in it. It was this book, who hopefully, if you're interested in this topic, it's called Periods Gone Public, and it's a guide to menstrual equity, written by Jennifer Weiss Wolf. And this is a fantastic book on this topic if you all are interested in learning more. I saw this book and was like, wow, I didn't really know this is an issue. I think a few of you have mentioned that this is something that you're just kind of learning about. But this is a topic that's really sweeping across the globe. You've probably heard that in New Zealand, they exempted all feminine hygiene products from taxes there. I think they've done similar in Great Britain. And I'll talk a little bit about what's going on here in the United States in a second. So here in North Carolina, I said, poverty is a huge issue, but periods actually don't have a big impact on our state revenue, which is why this bill seems like a no-brainer, because it would really help so many people in poverty, and it would have a very minimal impact on our state revenues here in North Carolina. And if you can't even probably see it, but that really tiny line there at the very top of my pie chart is what we take in state revenue and state sales tax for hygiene products. It is 0.07% of our entire state tax revenue. So it is extremely small. The last estimates that I got was around $5 million a year that this sales tax brings in. So it's so minimal in the grand scheme of what we talk about in the General Assembly. And so to me, it just seems like a no-brainer to pass. So I'll talk a little bit about what the bill language is. And I was talking to Michaela about, that the bill is pretty boring, but she thought it was interesting. So I'll go ahead and just explain a little bit about what this all means. It seems like just a lot of words, but the first two sections of the bill basically define what we're going to exclude from the sales tax. So in the first section, you can see is feminine hygiene products, and it defines what that is. And then it says, but it does not include grooming and hygiene products. So then we have to describe what grooming and hygiene products is. So that's why you see those two different areas. And I did want to make sure that everyone knew that I completely agree with what I think Michaela said at the beginning, that we should be calling these products menstrual products, not feminine hygiene products. But unfortunately, under our state sales tax code, they are defined as feminine hygiene products under what's called the streamlined sales agreement. And I'm not even going to get into all the different tax law because I don't understand it all. But when I drafted this bill, I went to bill drafting and said that I didn't want to call it feminine hygiene products. I wanted to call it menstrual hygiene products or menstrual products. And they said, we cannot do that because of the streamlined sales agreement, which basically kind of oversees how we do sales taxes across state lines. And that is how it's defined under this federal sales tax agreement. And so you cannot change that language. So I wanted you all to know that that was an important issue to me, but unfortunately, because of bill drafting, we were not allowed to do that. And then in section 2, basically all it says is that General Statute 105-164-13 is amended by adding a new subdivision to include feminine hygiene products. Then you might ask, well, what is 105-164.13? And that is all the products in North Carolina that are already exempt under our sales tax. And I wanted to tell you guys a little bit about what is already exempted in our sales tax, so you can see why this should be included in this statute. So other items that are exempt from sales tax, which you might not even know, that if we're talking about medical products, so medical products, some of the products that are exempt are prosthetic devices, mobility enhancing equipment like wheelchairs, if you have a prescription for that. If you don't, then they're not sales tax exempt. Durable medical equipment and supplies, only with a prescription. You can't exempt sales tax for, and that's like, bandages or like medical hospital beds, the equipment and those kind of things, but you have to have a prescription for all those things. Actually, diapers or incontinence products are exempt if you're on Medicaid and you have a prescription. So it's very limited about what is exempt in that area. And surprisingly, human blood and tissue is exempt under sales tax. I don't really understand that because I don't know who's buying and selling those kind of things, but they are exempt under sales tax. So I also thought it might be interesting for you to know other random things that are exempt under our sales tax, which makes me even more sure that this is something that should be included. And that is a lot of products that were obviously lobbied by big lobbying groups in the General Assembly that are now exempt, such as aircraft lobbying. Probably got aircraft lubricants, repair parts, and accessories are not sales under our sales tax code. Interior design services that are provided in conjunction with the sale of personal property. So you can see the interior design lobby came to the General Assembly and said, we don't want these taxed. Items regarding professional motorsports. And you know who did that? NASCAR came to the General Assembly and said, we don't want these taxed. 50% of a modular home or manufactured home are not sales tax. So you can see that what is taxed in North Carolina really doesn't sometimes have anything to do with the importance of it or the fact that it would probably help people not to be taxed. But a lot of times it has to do with a powerful lobby who probably comes up and lobbies for that. So that's why your voices are so important in making sure that we continue the conversation around why this is important to exempt from our sales tax and how it would help people. And you can use that statute and that section of our code to say, if you exempt motorsports and equipment that around NASCAR, I think you can exempt $5 million of sales tax for menstrual products. And then the last part of the section is just when it would become effective if it passed. So I mentioned before that, that this is really a movement that's sweeping across the country. Right now, 19 states have eliminated this tax in the United States, but 31 states do still have, what we call a luxury tax, which is what this bill would eliminate. So real quick, I just wanted to read a short passage from the book because I think it was just a really good summary of why these types of taxes are harmful and what they can do and why we should pass them. She says, simply stated, here's my case for what's wrong with the tampon tax. Menstrual products are used by half the population month after month and year after year to be productive members of society. Taking on and taking down the tampon tax has the potential to accomplish 4 key objectives. It lifts a small financial burden. It challenges laws that are archaic, unfair, and discriminatory. It helps inch toward a model of economic parity and gender equity. And it is a gateway for getting people to talk and think about the wider implications of menstruation, social, economic, and otherwise, in our policymaking. So when I read that, I was like, this is right up my alley. I am filing this bill. And if it would accomplish all those 4 things in our state, it would be amazing. So I want to thank you all for having me, and I'm happy to answer any questions about the bill or anything else. But I also wanted to give a quick shout out. I saw Amir was on the call. He is from Period Movement, which is a national organization that works for menstrual equity. And so I've been working with them to amplify this bill and this message. So I encourage you all to connect with them if you're interested in getting more involved, and maybe Amir can put in the chat information about how to get connected. So thanks so much, Michaela. I appreciate your time.
Thank you so much. I am going to share my screen one last time here because I do want to share with you that we are, when we talk about, I'm going to try and share my screen one last time here. When we're talking, we have these long-term solutions that we're discussing here, and that representative just spoke about, I also want to share with you that we're also looking at some of the short-term solutions. How do we reach out to people, especially this is focusing specifically on southeastern North Carolina, but we have many people who don't have access to menstrual products right now, individuals who are really trying to get their needs met. It's one of the top requested items at food pantries, including our food pantry on campus, Hawks Harvest, that's run by Sister Rose. And so we're asking people if they're interested. I mean, there's lots of different ways to donate and provide into your own local community. We're going to drop the link to our Amazon wish list also in the chat. But also because we are going to be filming, or we are recording this, we want to make sure that people can use this to find the link to find that if they want to donate. And we are having an in-person drive May 1st and 2nd in multiple locations. And again, I know my team is going to be dropping some information about that. So do consider following us. Now, I would love to open this up to questions. I'm going to go ahead and stop sharing this. And we'd love to hear from you any questions that you have. I'm sorry, because I haven't been following the chat. So actually, I'd like to start off. Representative, would you talk a little bit about what the process is now? So you filed this bill today, which is so exciting, and I'm so glad that we're here and able to celebrate this, right? What's the next steps for this bill?
Yeah, so for my bill in the House, it will actually be read in tomorrow for the first time on the floor of the House. So every bill has to go through 3 readings to pass the House. And so tomorrow it'll get its first reading and it'll be referred to a committee. So once we find out where it's referred to the committee, then it has to make it out of that committee in order to get back to the floor for a vote. So I will keep you all updated about what committee it's going to go to, and whatever committee it goes to, then we start advocating for that committee chair to hear the bill in committee.
And is that something, so that as constituents, is that something that we can write letters and emails and all that for? Is that when we come in?
Yep, that's when you should contact the committee chair of whatever committee it is referred to, because they have the power over what bills get heard. Mm-hmm. And so that's where you need to focus your energy, is on that chair or chairs of that committee, and say, we support this bill, we want you to hear it in committee and move it forward.
Great. And you'll see that Mary Claire, which is MC Curran, who is our PR specialist and also an alumni of UNCW, has dropped multiple links there that you can get access in terms of more information on this topic and the bills, also access to donation and the drive, and how you can get involved whichever level that you're interested in. Okay, so I'm going back and I'm looking at the chat. If you have a question in there, if you wouldn't mind dropping it in the chat so it's so we can find it a little bit easier, that would be fantastic. Any questions, thoughts? Okay, a question here, Dr. Wallace, for you. What is the, hold on, let me read this right here. Okay, what is something that we can do in terms of helping, in terms of health within our own communities, and helping support the health of menstruating people?
Well, one of the things that we talked about was destigmatization. So, I'm a huge advocate for being informed. And the only way that we can change our behaviors as far as saying things and behaving in ways that make people feel uncomfortable is to learn more about it and to encourage the understanding that is a natural process. So I would say just start with destigmatization, whether it's at the elementary school level, because most times this is when persons who menstruate begin within our families. Crowded circumstances do not always occur in convalescent settings. But then again, if you do have a position to have impact on policy, address those policies and protocols that may make a difference in those areas, such as persons who are incarcerated may stay in shelters. So I would just say that is how we can begin at the individual and community level.
Thank you. And building on that, this is from Philip White. Philip asks, what can be done to assist at a municipal level by our city council and county commissioners? Shonda, do you want to take that question?
Oh, anybody can? Okay. Yeah, of course. So one of the things we talked about was, for instance, the difference in bathroom settings.
Mhm.
So, just making sure that equity is distributed, in all settings, having gender neutral bathrooms with supplies. I mean, if you may have, condom supplies. You could also have menstrual supplies. And if it's, a non-gender conforming bathroom setting, whoever uses that bathroom have access, and they don't have to have concerns about, what their gender identity is. But having influence in those conversations to start in public change, I mean, that's a beginning. Our schools as well, our universities, those public settings, our government buildings.
Mm-hmm. Mm-hmm. I will say I'm really excited to share that at UNCW, the student governance did vote to put in a pilot project stocking menstrual hygiene products in four bathrooms across campus. And the idea is to see, okay, these are free of charge, to see is this something that people utilize? Is this something that's easy to restock? So on and so forth. But I am so exceptionally proud. I'm already a major fan of UNCW as it is, but I'm really proud of our student governance. And I know that Sister Rose was also part of that process to ensure that policy went into place. But it's very much setting the stage for long-term change at the university and engaging with menstruators and catching them where they are. And I will point out that Hawks Harvest, which is our food pantry at UNCW, does provide menstrual products and other hygiene items. And so I see that we have a few of our incredible students who are on here and some of our research assistants on here from UNCW. And again, this is a message for us all to share out. And I see that Bridget asks, is there something that can be brought directly to the New Hanover County School Board? So
again, I mean, I think the same approach can be made. So those conversations can come up to our advisory members. And once we start to inform them and they become more informed, these are topics that they can put on the table on our behalf. So by all means, that is what we should do. We should talk to our advisory board members. And of course, if this is a topic that is important to us, yes, it can be something that can be brought directly.
And Dr. Wallace, I don't want to speak for you, but I think that you'd be supportive of this. We would be happy to speak with anyone in New Hanover County or elsewhere about this. I know Representative Von Hafen would be happy to speak as well, but if we can help craft something to bring to the school board, we would be really happy to be part of that, or to the commissioners. We would be happy to be part of that and engage with that process. Okay, so I noticed that we are getting very close to 7 o'clock here. And I'm so thankful for all of you spending your Monday night with us. This is recorded and we are going to be able to share that recording. So, watch out for that. Please do consider sharing it, because this is a big part of this outreach is trying to reach as many people. And a lot of this kind of material, as we know, is stigmatized. And but it's also one of these pieces that once people learn about it, they become really interested and engaged. So please do consider following the links that we've provided. You don't have to donate, you don't have to provide, but certainly you can connect with us and our ongoing plans. And we're happy to talk to anybody about their own communities and how to get the ball rolling with this. Marla, let me turn it back to you.
Well, thank you so much, Michaela, and our entire panelists. I mean, Julie Mayfield, Natalie Murdock, Natasha Marcus, Julie Von Hafen, Deb Butler, all those representatives that were able to bring these bills forward. We're so appreciative, and certainly will lend our support in this important issue. So I appreciate everyone on the panel today. Certainly loved hearing from Dr. Wallace on all the health components and how that impacts so many. And so, Michaela, of course, I mean, you and your team just really pulled it all together in such a great way, made it so concise and easy to follow. So we appreciate all of you for bringing us this important information, and we'll make this available on our YouTube channel. So I will make sure that that gets sent out to you, and appreciate everyone coming tonight. We are at 7 o'clock. You guys are very prompt. So congratulations to all of you. You guys are pros. All right, I'm going to stop recording now. Thank you all for attending tonight.
Thank you so much.